Are you struggling with your weight and worried about your risk of developing type 2 diabetes? A new study may have the answer. The study, which was conducted over 18 months with 209 participants, found that practicing intermittent fasting for just 3 days a week could reduce your risk of developing type 2 diabetes. Those who practiced intermittent fasting had similar weight loss results to those on low-calorie diet, but with the added benefit of improved insulin sensitivity. In this video, we will explore the exciting findings of this study and provide practical tips on how to incorporate intermittent fasting into your daily routine. So if you are looking for a simple yet effective approach to better health, stick around and let's dive into the world of intermittent fasting. Did you know that in Asia, Buddhist monks have used intermittent fasting to overcome diseases and improve consciousness? A study found that people who fasted for 3 days a week and ate only between 8 am and 12 pm on those days had better blood sugar control after 6 months compared to those who ate fewer calories every day. Both groups lost a similar amount of weight. The results suggest that intermittent fasting may have health benefits beyond weight loss. However, more research is needed to determine if a slightly longer eating period could make this diet easier to follow over time. Approximately 1.4 million people are diagnosed with type 2 diabetes every year. Fasting might be a potential solution to prevent the disease, especially for those who are at risk. There are various types of fasting, but studies indicate that intermittent fasting could promote weight loss and improve heart and brain health by limiting food intake to specific hours of the day. Intermittent fasting can improve insulin sensitivity. However, diabetes is not a curable disease, but it can be managed. If you have diabetes, intermittent fasting can help you manage your blood sugar levels, and if you don't have diabetes, it can help you prevent the risk of getting it. However, if you are looking to replace all of your medications with intermittent fasting, that is not a recommended approach. Before trying anything new, you should consult your doctor. Thank you for watching.